Right, Ohio's Attorney General has filed a lawsuit against 5 major drug companies. The suit claims that they fueled the opioid epidemic that led to, quote, death waves. The Ohio Attorney General Mike DeWine says the companies purposely misled doctors and consumers about the risks and effects of these drugs. More than 30,000 people died from opioid and heroin overdoses in 2015 in Ohio alone. Opioid deaths jumped 36% between 2015 and 2016.
So we reached out to all of those drug makers. Allergan told us it doesn't have a comment. Johnson & Johnson said we firmly believe the allegations in the suit are both legally and factually unfounded. Teva Pharmaceutical said Teva believes that it is better for all concerned if the industry and public officials devote their resources to addressing the important public health issues relating to opioids rather than litigation. And Purdue Pharma told us, we share the Attorney General's concerns about the opioid crisis. We are committed to working collaboratively to find solutions. Endo did not return our request for comment. Joining us now is the Attorney General of Ohio, Mike DeWine. Thank you for being here.
Good morning. Thank you.
Good morning. So let's get to the evidence, because everyone agrees that the opioid crisis is real. It is urgent. It is devastating American families and claiming far too many lives. The question is, who's to blame? So your lawsuit takes on Big Pharma, takes on the big drug makers, and it states that these companies overstated the benefits of prescription opioids and understated the risks. You say the evidence shows that they did this to boost profits and deceive physicians who were prescribing these. What's the core of the evidence there?
Well, this we will show in court when we go to court. There's been a consistent pattern year after year to really understate, the danger. And they were leading physicians to believe that this product was not very addictive. They knew that that was simply not true. The epidemic we have in Ohio is fueled primarily by the pain med problem. We think about 3/4 of the people who, at least 3/4 of the people who are on heroin started with pain meds. The same thing would be true with fentanyl and carfentanil. So it's not just the people who are dying in Ohio of overdose of the pain meds. It's what ultimately that leads to. They get them addicted, and then they move on from there. So, this is really cutting at the heart and soul of Ohio. It is hard to describe the gravity of this problem. We have children's services who are overflowing in foster care with children because one or both parents are drug addicts. 50% of all the kids in foster care in Ohio are there because one or both parents are drug addicts. We've got emergency rooms that are overflowing. We've got coroners who simply have run out of money, and it's hard for them to even do the autopsies. It's hard for them to even find space. So it's a tragic problem.
And the numbers are devastating. And the numbers are simply devastating, Mr. Attorney General. And some of the statistics you cite in your own suit, in 2012, for instance, opioid prescriptions in Ohio, 68 pills a year for every resident, including children. That is staggering. But as to the suit itself, why take it up with the manufacturers and not the distributors? Why not go after the people getting these drugs out there, or the doctors or the hospitals prescribing them?
Well, we have not said we're not going to go after the distributors, but we looked at this evidence. I've looked at it very long and hard and made the decision that we clearly feel that we have the evidence to prove this in court, and that's why we have filed it. You have to understand what they did is they targeted general practitioner doctors. That's who they went after. They did not really go after the pain specialists. They go to the people you and I would go in to see about any kind of problem. They set up basically fake groups, or groups that they funded that were supposed to be impartial, very similar to what the tobacco industry did. And they funded them, and these groups, of course, were promoting the product and saying it's not very addictive. Their sales reps were going out and telling doctors this is really not very addictive. So they
Attorney General,
grossly understated the danger.
Mr. Attorney General, not to interrupt, but we're running out of time. I want to get you on this.
Sure.
President Trump has promised. Well, it was a big campaign promise. I will stem I will stem this wave, this epidemic. I will help find a solution for this. Looking at the Trump budget that's been proposed, it indicates that the Office of the National Drug Policy will receive cuts, and a recent Politico report notes that This 2018 budget proposal by the White House would slash funding significantly to the Substance Abuse and Mental Health Administration. Those are the vehicles through which help comes to people in your state that is reeling right now. Would you support any cuts to either of those departments?
Well, we certainly need more help, and one of the things that Senator Portman has done and other senators have done is to pass a bill last year, very, very significant. We're starting to see the results of that as some money is coming back to Ohio. So no, everybody has to be involved in this fight. One of the things that I said yesterday is the fact that we have filed this lawsuit against the 5 pharmaceutical companies should not in any way tell anyone in Ohio or any place else that we need to stop doing what we're doing. The story in Ohio is that while this tsunami continues to come, we've got people in many counties, many communities who are doing great work. They need to keep doing that, and we need to keep encouraging them to do that.
This is something that needs to be handled nationally as well. It's a national crisis. We all need to pitch in. Attorney General Mike DeWine of Ohio, thanks so much for being with us. Really appreciate your time, sir.
Thank you.